just at my side, or if I'm just in a sitting or laying down position, the AC and the SC joint, and that's the open pack or resting position. All right, who we got that's going to do AC and SC joint bolts? Let's have you have a seat first. So AC joint, face that way if you don't mind. Perfect. AC joint, the only one we're going to do is the anterior mold. It's a pretty simple process. I'll show it on both sides. It's just so you guys don't have to move about. So all we're going to do is stabilize the acromion. So in this case, if you had it on, I'm stabilizing the acromion. I'm working through the upper tract to get onto the clavicle, and then I'm just pushing forward. So it's an anterior mobilization. So simple as grabbing the acromion. First, I usually like to find the clavicle, all right? Then I'm going to just stabilize here. Again, this is one that can be a little bit sore because I have to work through the upper tract. I can't get up top here and do that. That's going to not produce the anterior mold. I need to kind of come through the upper tract and behind like that. So I'm still trying to get as many fingers as I can up there because, again, I don't want it to be a point that hurts. So I'm just holding stable, getting behind on the clavicle, and I'm just pushing forward. Now, I do this. Often they talk about not moving both hands, but if I'm pulling acromion back and pushing forward, I think I get a little more effective motion. So technically, stabilize, don't move, but if you said, boy, it looks like you're kind of doing that, I am probably doing that, okay? So because I'm mobilizing right at the AC joint line, which I should be able to find. When I find the AC joint line, I'm just doing that. So it looks a little something like this for you guys on this side. Finding the clavicle, finding the AC joint, holding on the acromion, coming through the back of the upper tract, and pushing forward. So I'm pushing kind of back and forward, okay? So pulling back, pushing forward. Lay on your back. Sternoclavicular joint, that joint that it feels very funny to kind of move around, all right? If we're going to do a posterior, so we're basically just going to find the clavicle. Again, in this case, we don't have to do a lot of stabilization. His body weight is going to control his sternum, right? So we don't have to do a lot there. If we do a posterior mobilization, it's trying to help retraction, okay? So if I'm moving it back. So posterior is the easiest one because I'm just pushing straight down into him, right? Anterior is the one that people don't like because I'm basically trying to take his clavicle and pull it off, all right? When I do that, that's helping protraction, all right? So posterior mob is helping retraction, anterior mob is helping protraction. So I'm basically going to, let me see where it'll be hard to see, but you guys, I think we've done this before. We're finding his SC joint, and again, a posterior mob would be just pushing straight back onto it. An anterior mold would be trying to get underneath it and trying to lift it off. He's a little bit hard. You're going to find some people where you can easily grab a hold of. He has enough neck musculature that, you know, I would have to really kind of work. If I wanted to kind of to work at it for a while, I could dig underneath there. It's going to, I'll tell you, it's going to highly depend on your patient if they're going to let you dig. Now, when would I do this? Probably, again, you're going to probably see some therapists that say, hey, listen, we should address the SC joint and the AC joint right away, and they are totally right. I'm going to tell you it's usually clinically, though, the last joint we go after. We're saying, hey, listen, if your shoulder can't move, don't you have a problem with your scapular mobility? Don't you have a problem with your glenohumeral mobility? We're going to start in all those places. And for me, it's usually like, gosh, I'm just not quite getting done. And then they all of a sudden start saying, hey, I'm having some pain like here. And I go, oh boy. All right, here we go. Let's start moving the SC joint, okay? So that it's a possible. It's not wrong to start there. People generally don't like it too much when you poke there, though. So that's posterior and anterior. We also have, which is not too bad, superior, which would be pushing it this way, and caudal, which is pushing it that way. Superior helps clavicle depression, right? Caudal helps clavicle elevation. So you can see out of the ones we're doing, that one might be a nice one. So if we can get the clavicle to elevate, what happens? We clear some space in the glenohumeral joint. So for me, the one that I would go to would be an inferior glide if I have a shoulder problem. So that's simply I'm getting my hands kind of like so, and I'm pushing inferiorly, or I'm pulling superiorly, all right? And it's the easiest one to do besides posterior is pushing down, and it's probably the most effective. So I push down on this side, that side comes up, that clear space, that's gonna be a good thing. So if I don't have the proper inferior mobility of this, that's gonna impact my elevation at my shoulder. So easiest one to do, right? So we're here, pushing down, all right? You can use the grades there. Again, grade 1 is gonna be almost, try grade 1 on this because it's almost not even moving. Grade 1 would be just kind of nice little play on it. Grade 4, again, take up the slack. Once I take up all the slack, then I kind of, in my case, kind of bounce on it a little bit, okay? That's grade 4. Okay? So let's try AC, and again, arms at the side, because that's a closed pack or open pack position. When he was sitting, just arm at side. When he's laying down, arm at side, or I mean, in that position where we're gonna have him, okay? All right, let's do those 5.